The first time, let's say, that I was diagnosed, or somebody told me that I have scoliosis, is I was on a routinary checkup, on a medical routinary checkup, because I was swimming. I was 10, I was swimming back then. And a doctor told my mother, she has a mild scoliosis, but don't worry about it, let's wait and see. So that, that wait and see, after a year, turned into that my mother was trying on me a blazer, a jacket, and she was like, Vanda, stay straight. I was like, I am straight. Vanda, stay straight. I am straight. So I was twisted, you know, one shoulder up. So long story short, they found the best specialist in scoliosis in Milan. We are talking about a classic vision of scoliosis. That, you know, the first appointment with him was, okay, this is your x-ray, you are a severe case. You have already, I have like a back like an S, so it's like a two main curves are like a 28 degrees. I'm gonna put the brace on you, and he showed me the brace. And if it's 6 months, you don't get better, you're gonna go to surgery. I was 10, so this was great specialist, but zero empathy, let's say. After I finished my, let's say, the first treatment 30 years ago with scoliosis, I kind of neglected my back. Neglected meaning that the doctor didn't tell me that, for instance, that the scoliosis would like degenerate, or that the curve is gonna turn even bigger. So I was completely blind of this information. I started to feel discomfort, let's say, after 40, more than usual. I was like, back hurt me, I don't know, this is not normal.
Somewhere around between 40 and 50, the progression is added to itself. This progression as the adult, in the adult phase, is what leads to pain. So you can progress 40, 50 degrees as a child and feel nothing, and then progress 5 degrees as a young adult, feel nothing. Progress another 5 degrees between 40 and 50, now you start to feel pain because it's added to what you already had. And that's the difference. I call this like the snowball effect that happens with scoliosis. As patients get older, their curve slowly increases, the speed of how much it progresses, and therefore it's going to increase what you feel as a result of the scoliosis.
I live in Italy 18 years, and now I'm in Spain, and I've been living on the island of Ibiza for the last 17 years. So I say, if I come here, maybe I bring the family. There's a Disney here, so that's how, you know, I found that there is a Dr. Tony in Celebration. We scheduled a Zoom call. The call with Tony was, for me, enlightening, because he really explained me all these things about how the scoliosis progresses and how it works, and also the job they're doing here. And I was also looking at all the testimonials in the video, so it was pretty impressive. It was 2 weeks, you know, intense, because let's be honest, the intensive care treatment is no wellness and spa. So you come here to work hard. If you want results, you work hard, because it's a combination, you know, doctor and Dr. Tony and his staff, they put all their professionalism here, but also the patient, you know, have to be willing to work hard.
What's unique about intensive care, and especially the care that we prescribe here at Scoliosis Reduction Center, is that we work at the pace that the patient can work at. So a patient that's very motivated, like Vanda, can really push hard and try to push her spine to as straight as she can possibly get at, so she can control the amount of pressure and tension that we're applying to the spine to try to achieve further results. Where if somebody is, hey, I want to go a little slower, I don't want to work as hard, or they're scared to, we can work at a slower rate. But the most important thing is the patient has control at how fast they want to go with the treatment, and also how much pressure they want to apply. Because we know the more we reduce the curve, the better results they can get. So working hard is definitely important. It's definitely a factor, but it's not impossible. Working hard doesn't mean working in massive pain. It just means trying a little bit more that you may be capable of that you don't think you really are.
When I came here, the two main curves, let's say, the S's, the thorax one was 58, and the bottom one, I think, 42. And now, after my, let's say, second session or third week, my thorax is 40, so from 58 to 40, and my bottom one is 33, I think. It's a miracle. The biggest motivation to come here, as I said, and travel and all the complications traveling now, and also the, you know, the money, it's that what they do here, they don't do, first of all, they don't do in Europe. And instead of trying this treatment and I go for the one that really works.
What happens is a lot of our healthcare system is fragmented in such a way that everybody specializes in one thing. And this specialization is great, but the problem is it creates a fragmented system where patients will receive recommendations from different doctors and therapists that I see actually work against each other. So what we do in our clinic is we take all of these different things, the therapy, the rehab, the exercise, the bracing, the overall management, and I coordinate every single piece. And there's this coordination along with all the specific scoliosis treatments that make people say, I want to go there because I'm going to get everything done in one clinic, done correctly, coordinated by one doctor to make sure that I get the very best results in the shortest period of time. Because the value of reducing scoliosis effectively, it far outweighs the cost of travel.
Tell me a word that is like, if you summarize awesome, great, fantastic, incredible. Is there anything else I can say?